Hi guys, it's Sarah Norwood. I am going to be recording most of this video blog from my bed because this is where I've spent many months this year in 2024. Today I'm starting a new journey, which I want to document to help other patients, other people that suffer something called functional neurological disorder. And the way I can describe functional neurological disorder is that it's not something wrong with the hardware in your brain, like epilepsy or epileptic seizures. There's something misfiring with the software of your brain and body and nervous system. So your brain is trying to tell your body to walk or do something, and your body is involuntarily doing something completely different. And you can have full-blown seizures, which mirror and are exactly like epileptic seizures. You can have tics, tremors, movement disorders. You can black out. You can faint. You can lose all ability to walk or speak. And this is what's happened to me. And I've always kind of had, since 2011, neurological things weird things that have happened. I've been diagnosed with all these different rare disorders, but they weren't quite sure. And then last year I started walking, like sideways once in a while and off balance. And I would just like start walking to the right and then fall to the ground. And I started with these hemiplegic stroke-like migraines back in 2019, where like part of my face would droop and I slurred my speech and I had trouble talking. And then last year, things really amped up and I started having this weakening on the left side of my body. And, you know, my MRIs would be normal. And it wasn't until my neurologist said, I think you have FND, functional neurological disorder. Well, I kind of poo-pooed it because a lot of times this disorder comes from trauma or has a psychological component. And people with FND have often been dismissed by doctors or told they're over emotional or crazy or making up their symptoms, which they absolutely aren't. Their symptoms a lot of times are subconscious, and there's triggers that happen, and then all of a sudden their body has these involuntary symptoms and reactions that they can't control. And this is what happened to me on July 4th of this year. 2 months prior, I had gone blind in my right eye and started getting all these tests, and again, couldn't figure it out. Well, July 4th, I woke up in a lot of pain, and I ended up having a little anxiety attack. But all of a sudden, I dropped to the ground, and I told my husband to call 911 because I was going to start passing out. Instantly, I went into a full-blown seizure, which they thought was a stroke. I could not speak. I was going, and this is what happens with my face. It goes, It looks awful. My hands contort. Oftentimes, I'll look like, I don't even know how to describe it, but we call them T-Rex arms. I get paralyzed. I can't move. I can't speak. It was terrifying. I've had to have 24/7 around the clock care. My son even he can't work because I need someone here when my husband, don't you love that? When my husband's not home. So I'm starting a journey today, which is an 18-week intensive kind of FND therapy through the Ann Schutz non-epileptic seizure programming clinic. And everything that I learn, I'm going to share with you guys, because they say this is a rare disorder, but really it's not. It's just undiagnosed and not recognized, and there isn't enough awareness. And I'm going to make it my new purpose and journey to help people, especially that have suffered trauma, that now their bodies are trying to release that trauma. They're starting to get these seizures, or they're starting to have blindness or twitching or can't speak, and their language and physical body is starting to become affected. I want to learn how I can help you in the future. So I just wanted to share this beginning of an 18-week program, and I will keep you guys up to date. And I miss you guys, and I love you all. Take care of yourself.